May is National Blood Pressure Awareness and Education Month, and we're here at St. Mary's Southwest Campus in the Byron Center area, Advantage Health Physician Network, with this guy, Stephen DeLapp. He's a family practice doctor here, and it's part of everybody's regular routine exam to have a blood pressure check.
Absolutely. Blood pressure is critical because it tells us essentially how the heart's working. And we call blood pressure the silent killer because people feel great while they have hypertension until pathology is already developed. Now that takes years. That's why we need to catch high blood pressure before that pathology is developed.
Sounds like it's kind of one of those simple screening things. It gives you a lot of information.
Absolutely. It takes literally minutes to do. You not only can do it in the doctor's office, most pharmacies have it now, just a little machine, so that are actually pretty accurate, just to check your blood pressure.
What are some of the risk factors? You know, my dad has high blood pressure. He had triple bypass surgery on my birthday last year. Does that mean that I'm someone who should really watch my blood pressure?
Well, you should watch your blood pressure. Risk factors are smoking, big risk factor, obesity, lack of exercise, family history is a risk factor. All those things are preventable if we intervene early in life.
All right, I'm going to roll up my sleeve and let you tell me my numbers here.
I will.
On the air.
So we do this every time you come into the doctor's office. The nurse is going to slap one of these things on you, and watch this dial. On this dial, we listen for certain sounds. That's why usually people are pretty quiet when we check the blood pressure, because some of the sounds are pretty hard to hear. So let's check it right now on you.
Okay.
So what I usually go up to about 200, and then we'll come on down slowly. First number. Got pretty good blood pressure. I got about 105/68.
Really?
Yeah, that's very good.
Okay, so what's the normal range?
So what we consider normal is about 120/80. That'd be like the ideal blood pressure would be 115 beneath 80. Now, normal, if you consider normal, what does the average person come in with? Usually above that. Anything above 130, between 130 and 140, that's that top number, we consider pre-hypertension. Okay. And we watch that. And depending on your risk factors, for instance, if you're a diabetic with that pre-hypertensive range, then we'll get a little bit more aggressive trying to get that down. Okay, now what do those numbers mean? Is it how fast your heart's beating? No, not necessarily, although that contributes to the blood pressure rate. The top number is how much pressure is in your arteries when that heart is compressed or squeezing that blood out. Okay. Now that bottom number is ask the question, well, how much pressure is there when your heart's relaxed? Okay, so for you, when your heart was squeezing, your heart had to generate 105 millimeters of mercury of pressure in order to push that blood around. Okay. And when your heart was relaxed, it only had to generate about 60 millimeters of mercury in order to push that blood around. So people who have high blood pressure, their heart's really working pretty hard because it has to generate higher pressures in order to circulate blood around your body. Okay, if somebody has high blood pressure, what are the things that they can do? Yeah, depending on where they're at. If they're in the pre-hypertensive stage, we'll talk about lifestyle intervention. That begins with diet and exercise. Exercise is so critical. Not only does it help with your blood pressure, it helps with your mind and all kinds of other areas of your body. So we really push the exercise and the diet control. Then we also talk about the DASH diet. DASH diet stands for Dietary Approaches to Stop Hypertension. Okay. And you can find it on the internet. Essentially, it's increasing your portions of fruits and vegetables, decreasing your sodium, and decreasing your fat intake. We also talk about stopping smoking, stopping alcohol use. Okay, all those healthy lifestyle choices we all should make. Right. So think about putting your cuff on, visiting your doctor, and getting those important numbers, especially now in the month of May when we're really bringing awareness to blood pressure and the problems associated with high blood pressure.
And you know, it's really telling when the healthcare community calls it the silent killer. And because you can be walking around for years with high blood pressure developing, causing those problems to just start developing, and they really accumulate into some big issues through the years. In patients with high blood pressure, the first steps toward treatment are really very straightforward, almost simple sounding things. Lifestyle changes. If someone smokes, you should stop smoking, eating a low-fat, high-fiber, low-sodium diet. The first medications are typically diuretics. Some of those you can even find over the counter. If those don't work, there are several lines of medication, starting with ACE inhibitors and beta blockers. So again, it's something that you can really treat pretty simply if you catch it really early.
And high blood pressure is called a silent killer, and so many of us can feel fine and function normally even with high blood pressure. This can go on for years, just like you're mentioning, and blood pressure screenings can take place at doctor's offices, pharmacies, pretty routine, and it's a minute-long test that can be essentially life-saving.
Exactly, yeah. Do it at least once a year. That's why those yearly physicals are so important.
And if you get blood, you do it like 3 times.
You do it all the time.